For this discussion, I would like to talk about home health care and the requirements of the advanced practice clinician or provider as far as documentation goes and selecting appropriate diagnosis codes. As of 2020, the Center for Medicare and Medicaid Services, or CMS, has required that home health care visits meet the standards of outcome and assessment information set, also known as OASIS. What OASIS is a group of standard data elements that provide a comparative measure of the home health care patient at two different points in time. And OASIS is part of a comprehensive clinical assessment that you as the provider um, complete on the patient, and thus paints a clinical picture of the patient and the severity of their condition and the requirements, whether it be low, moderate, or high, their needs for home health care. So just a few a few best practices for documentation when you are documenting your home health care encounters. First, being that typically we aren't going to use resolved diagnoses under your plan of care, and that's because if the diagnosis has been resolved and is no longer an issue, it doesn't currently contribute to your plan of care, so it would only be appropriate to list this under the patient's medical history. Again, with listing diagnosis codes, typically symptom codes are not going to be accepted, and they will never be accepted as a primary diagnosis code. But as a secondary diagnosis code, you're going to want to be as specific as possible when listing diagnoses. So if the patient does have a flare of osteoarthritis of the left knee, it's always advisable to choose osteoarthritis of left knee versus left knee pain. And then diagnoses, they're listed. The primary diagnosis is arrived at after the OASIS documentation is complete and you, the provider, have arrived at what the primary diagnosis is that's most related to the current home health plan of care, meaning that this diagnosis is the one which is the most acute condition requiring the most intensive services. That's going to be your primary diagnosis, and that's the one you're going to want to make sure falls under that PDGM and is an accepted diagnosis code. Again, I listed on the next slide the link so you can look up codes that you may question if they are an accepted code. And a few examples would be something that used to be considered a questionable code, perhaps an ataxic gait. Now that code is no longer accepted, and you're going to have to dig a little bit deeper. Perhaps it's a history of head trauma, stroke, MS, or sequelae from CVA. So you're going to want to be as specific as possible when listing that code. And then also part of your documentation, and within the OASIS format, you will fill out several important data points, one being the admission source and the timing of the admission. So was the patient admitted straight from the community, or was this after being in an institution such as a hospitalization? So if it falls within a time frame of 14 days from hospitalization, or were they admitted to home health care from a community setting? So those are things that are important, and they will be found under the OASIS document set, but just know that that is important as part of your documentation. And then when you verify that your diagnoses do fall under that PDGM, additional adjustments are made both from a functional impairment standpoint, that's assessed on the OASIS form as well, whether that is a low, medium, or high functional impairment, as well as a comorbidity adjustment. And that is made by your clinical judgment as far as does the patient meet no, low, or high comorbidity adjustment criteria based on comorbidities secondary to the primary diagnosis. And here I just have an illustration of the different PDGM clinical groups and the primary reason for home health care based on that grouping. And I did think it was interesting to note that the OASIS guideline manual does state that the um, clinician is expected to complete the patient's comprehensive assessment and understand the patient's overall medical condition and care needs before selecting and assigning the diagnoses. So this is speaking specifically to the primary diagnosis. So that is when you are using your OASIS assessment tool to arrive at what that primary diagnosis is going to be for the patient, their primary reason for requiring home health care. So these 12 groupings are broken up into number 1 and 2, musculoskeletal or neurostroke rehabilitation, primary reason being therapy for the condition. Third would be wounds, both postoperative and non-surgical wound care. Primary reason being assessment, treatment, and evaluation of the wound. The fourth being behavioral health care, and the primary reason for the home health is assessment, treatment, and evaluation of conditions. And interestingly, this does include substance abuse. So perhaps the patient has a substance abuse issue that is the primary reason requiring home health care. So I thought that that was nice that that was noted in there. Next is complex nursing interventions. These are going to be your patients who require complex medical and surgical aftercare, things like IV medication, parenteral nutrition, etc. And then the last group of groupings would be your medication management, teaching, and assessment of. And there are 7 different categories here: surgical aftercare, cardiac or circulatory, endocrine, GIGU, infectious disease or blood diseases, and that includes our oncological patients, respiratory, and other. And the primary reason for home health for these groups are assessment, treatment, and evaluation for a variety of conditions not classified above. Excuse me. So I just wanted to have this visual listed here for you, as well as that Medicare link, so that you can use that website if you are ever questioning whether or not a primary diagnosis is going to be under that PDGM acceptable diagnoses.